Hello. We have gathered information on how women-centered care can better treat pregnant women who are addicted to drugs during their pregnancy. We find it important that we educate OB nurses on the proper screening for substance abuse, how women-centered care can lessen relapse rates, and educate on local resources. Take a minute to think about the Cincinnati community and the struggling mothers that could benefit from our help. Research has shown the incidence rate for opioid and alcohol use has greatly increased within the past 20 years. Being educated on the symptoms of withdrawal from substance abuse is crucial. The nurse's role as a direct care provider is to assess, educate, and refer based on specific patient needs. In a research study, 2 groups of pregnant women were divided into subgroups. Group 1 received women-centered services during the pre- and postnatal period, while Group 2 did not. Group 1 was provided with trauma-enforced care, child care, prenatal and postpartum care, pregnancy-specific dosing, housing and transportation assistance, breastfeeding education, family planning counseling, STI screening, and parenting skills training. The researcher looked at different ways to measure the successfulness of women-centered care through the number of postpartum visits, those now using a long-acting contraceptive, and those who actively breastfed after discharge. As a result of this research, it was concluded that this women-centered service that was provided to these pregnant women better affected the outcome in child care following their pregnancies. The study looked at the difference between pregnancy-only support groups and mixed-gender support groups. OBGYN providers co-led the groups and discussed pregnancy and birth-related topics. When comparing the group relapse rates, the mixed-gender group had a 25% higher chance of relapse. The group therapists experienced a higher level of cohesion and trust among the participants in the pregnancy-only group. The pregnancy group members helped one another problem-solve transportation and child care issues, which are often gender-specific barriers to treatment for women. Lastly, 3 potential group members refused to participate in the study because they only wanted to be in the pregnancy-only group. This shows that there is a population who would seek help if they could be in an environment of all women. Nurses are a key group in informing women about alcohol consumption during pregnancy and its consequences. We aim to reduce this knowledge gap by understanding nurses' perceptions of their practice in addressing alcohol consumption during pregnancy. Pregnant women's drinking behaviors is an attribute to the information they received from nurses. A study we found explored women's perception of information they received about alcohol use during pregnancy. The findings suggest that women reported a number of problems and inconsistencies with the information about alcohol use, mixed messages and confusion about identifying a safe level of consumption had implications on women's decisions to drink or abstain during pregnancy, and women expressed a need for a clear, consistent message to be provided to women as early as possible. Screening can distinguish patients with low-risk substance use from those with risky use, harmful use, or dependence. The main purpose of the most screening tools is to identify patients with substance or abuse disorders who can benefit from early intervention and treatment. Universal implementation of alcohol screening and brief counseling to pregnant women and persons of reproductive age could help with the achievement of decreasing the number of women that use opioids and alcohol during pregnancy. We found a research article that discussed the importance of group therapy. 2 major themes emerged from the focus group transcripts. First, women find the educational content useful, and secondly, women appreciate the social support provided by the groups. These women spoke in length about the guilt they felt pre- and postpartum and how support groups had more benefits for them than just crushing their addiction. Pairing support groups with education is key. There are many barriers when it comes to treatment for dependent mothers, some of which include transportation issues, childcare, a lack of education, the fear of the stigma that comes with seeking help, especially when it comes to help with drugs. Many mothers fear punishment and or looking like a bad mother. Other issues include cost of treatment and insurance or the lack of, logistical issues when setting up appointment times and pairing them with group sessions, and the environment. Some women have expressed their desire for women-only support groups and have turned down care for mixed-gender support groups. Making these women feel safe, supported, and non-judged is extremely important when it comes to positive outcomes and retention. Here is a local resource we discovered that nurses may refer their patients to called First Step Home, located in Walnut Hills, Cincinnati. Additionally, we found a local Addiction Services Council outpatient service that serves northern Kentucky and the greater Cincinnati area. On a national level, we found both the American Pregnancy Helpline and the National Council on Alcoholism and Drug Dependence, which could be referred to for patients all over the country. We decided to educate the nurses and students on the labor and delivery unit at Fort Hamilton Hospital about proper screening tools for substance abuse, how women-centered care can lessen relapse rates, and options for available resources. We administered a pretest to gather the audience's baseline knowledge prior to education. The questions on the pretest focused on the participants' level of comfort discussing substance abuse, confidence in their hospital screening tool, and if they are aware of any resources to offer to patients. After presenting an educational pamphlet and a live PowerPoint to the audience, a post-test was administered. The post-test consisted of the same 4 questions as the pre-test and an additional 3 questions to gauge how successful our education was perceived. Looking at question 1 on both pre- and post-test, you can see that the audience we presented to felt more comfortable asking about substance abuse. Looking at question 3 on pre-test and question 2 on post-test, you can see that the audience we presented to felt as if they had way more resources to provide to their patients. Here are our citations. We hope the education presented will make an impact and lead to better outcomes for struggling mothers in the Cincinnati area and even beyond. Thank you again for listening.